Hello, this is an introductory video for Advocacy services I'm offering. My name is Edith Mahachi and I am a nurse by background with over 20 years of experience working in acute care systems. And I have started a patient advocacy service to make sure and to bridge the gap between the healthcare system and the understanding which is provided to the patients and their families. And throughout the years when I've been working within the system, I've noticed a lot of communication breakdown, a lot of incidents that have happened that could have been avoided. And I am an advocate for avoidable harm. And I'm here to make sure that patients are advocated for, patients are understand what their care is when they are in hospital. So my services are more on patient involvement, patient engagement, patient experience, and above all, patient safety is what I believe in. And I have been thinking about this for over a long time. That all these incidents, like when I am an independent investigator, which I have been over the years for certain incidents that have happened in healthcare, and some of the things could have been avoided, and some of the harm that has happened to patients could have been avoided, and some of it was due to communication breakdown. So I've been thinking about this for over a long period of time, that who is going to stand for the patient. I hear most of the time, like, people bring their stories, and I've been to some conferences as well where patients have told of their stories, and I've been in risk assessment conferences, or even the symposiums we normally undertake within our own organizations to make sure that we learn from mistakes. But how can we avoid? There are several ways to avoid these mistakes, and part of it is patient advocacy, going through the patient's journey. And the things I advocate for are obviously making sure that the patient's journey is safe as possible, making sure that patient experience is the best they can ever have, making sure that patients are involved in the care that they are in hospital or in healthcare for, and making sure that there is engagement at every step of decision making within the care system, and the patient understands, the family understands, and also if there is any further care plan for the patient. If the patient does not understand, I am here to bridge that gap, to sit down with the patient and the family to explain what is being said to by the clinicians. The healthcare system is very complex nowadays. The modern healthcare system is overwhelmed with shortages of staff, and staff most of the time do not have the time to communicate with patients. And I've been thinking, what is the solution to this? At the same time, patient care comes first. Communication is key, but communication is not always happening, and most of the times probably there is a language barrier and the patient cannot understand, and there are also health inequalities which are happening, and sometimes patients are always left with questions and no one can ever answer these questions. This is where patient advocates come in, to try and break down all the information to the level of the patient's understanding. So I'll be sharing more videos about patient involvement, more videos about patient safety, patient experience, patient engagement, and just the patient journey as well as a whole. If you are keen to listen to more of these things, please subscribe to my videos and check out later. Bye.